It is a coronavirus, first established in China, has subsequently spread to multiple other countries. The United States is now becoming more involved. We've got a number of hot spots, mostly associated with travel here in the United States, but we are starting to see some person-to-person transmission. So a little bit about the disease. It presents primarily with fever, cough, and what's really unusual is increased shortness of breath out of proportion to what you would ever see with a cold or possibly even flu. So we look for that fever. Right now we're working on making the epidemiologic link. So if we know that you've been exposed to somebody, those are types of people that we're doing testing. Now we're getting a lot of questions on testing, and testing is becoming more widely available. Certainly a number of our commercial labs are coming online to provide testing. Tennessee Department of Health is also providing testing, but it must be approved through your local health department, and then we get permission from Nashville to get that done. As we see more and more cases and have more and more labs available, then that should make it a lot easier to get our testing done. So people are real worried about this illness, and I think there's a lot of mass hysteria that's going on right now that may not necessarily be appropriate. It is important that we have, our regular day-to-day preparations that we should do for any other type of emergency, be it blizzard, tornado, flood, whatever. You should have a communications plan for your family. You should have 1 to 2 weeks worth of food on hand should you be stuck at the house. And of course, people on a lot of medications need to be sure they've got an extra month ahead just to keep ahead. But otherwise, no special preparation. When we look at how sick does this make you, 80% of patients will not need any type of medical care or may not even know that they have it. So we know 8 out of 10, particularly in the young people, are not going to have trouble. We're not seeing this much in children. So 80% of people are going to do okay, may not even know that they had it, or may get testing, mild illness, and we isolate them for the length of their illness or up to 14 days. 15% of patients, particularly those who are older with more comorbid conditions, 15% of those patients are going to get ill enough to seek medical care. 5% of those patients are going to get really sick, going to need to go to the intensive care unit, need ventilator support. And those people are usually people who are greater than the age of 60 with comorbid conditions. And by that I mean lung disease, heart disease, diabetes, cancer treatment, biologic therapy. Those are the patients at greatest risk to have complications and die from this disease. Worldwide, we're seeing a death rate of 2 to 3%, but most of that is all in the elderly. We're not seeing hardly any disease in the children. So what do we do to prevent it? Right now we don't have a treatment. We don't have any good antiviral treatments. We don't have a vaccine, although we're working on a vaccine, and vaccines will be a minimum of probably 18 months before we can use those to help mitigate the effects of the disease. So it comes back to our basic public health prevention 101, particularly for the respiratory viruses. Looking at this type of preventive techniques includes a number of modalities. The first includes respiratory etiquette, so cover a cough or a sneeze. Don't touch your face. We as humans tend to touch our face up to 1,000 times a day. It's just the way we are. We touch our face a lot. But what happens is we contaminate our hands, and then we put it into our eyes or our nose or our mouth, and therein we pick up all the respiratory viruses, just not COVID-19, but flu, other coronaviruses, adenoviruses, rhinoviruses. They're all very common in circulating. Luckily, we're winding down for the season right now. The other is cleaning the environment. Most of these viruses, most of the respiratory viruses can live 24 hours or a little longer on hard, non-porous surfaces. So doorknobs, tables, things like that. On non-porous surfaces, other respiratory viruses can only live 30 minutes to a couple of hours, so in a tissue or cloth or whatever. Now, they're still studying this COVID-19, how long it really can live. Some studies suggest up to 9 days, but basically simple environmental cleaning. And when I talk about environmental cleaning, it's the things that you touch all the time. Your cell phone is probably the most contaminated thing around you. Keyboards, doorknobs, places that we touch often or that we work with our hands are the most commonly contaminated. The other concept that we talk about in preventing this disease is called social distancing. This disease is spread by droplet spread. So with social distancing, we want to keep about 6 feet away from other people if you possibly can, because that's how far droplets tend to travel. Do face masks make a difference? In the general run of things, absolutely not. Now, if you've got a sick person who's coughing, a surgical mask can make a difference in spreading those droplets. But the surgical mask prevents it from an infected patient going out to those around them. The use of N95 mask and other high-level masks is not really indicated, and if you've not been fit tested, they actually don't work. You have to be sure that you've got a good, almost surgical seal around the breathing apparatus to prevent aspiration of the particles that you get. So social distancing becomes important, respiratory etiquette, and then finally hand washing, hand washing, hand washing, and then wash your hands again. Our hands is where we pick it up the most, and it's not just throwing your hands under the water. It is putting your hands under the water, washing with soap, washing the fingernails between, and there's a great CDC website that you can go to on how to properly wash your hands and sing Happy Birthday or a number of other tunes that they've now picked out. So keeping your hands washed is so important. Alcohol hand sanitizer works on the respiratory bugs, not so great for the GI bugs, but the respiratory bugs hand sanitizer is also an effective method. If someone is ill, certainly if they've got shortness of breath with it, now that's the difference between the common colds and other upper respiratory, but shortness of breath is one of the key indicators that we looked at, and at that point you need to be evaluated by your primary care physician or your other provider. The other is if you've had travel to an endemic region, or you've had a known exposure to a known case, then before you go, let them know so that we can isolate you from the waiting room, put a little surgical mask on the one who's sick, and then get them into a room and evaluate if we need to do any type of further testing. Absolutely, and that goes into the concept of social distancing, that first maintaining 6 feet to protect yourself from droplet spread, but also when you're ill, we need to practice staying home now. And in our culture, that's not been strongly practiced with the American work ethic. But if you can work from home, then we need to look at alternative strategies for people working from home should the case arise. And if you're sick, you definitely need to be staying home. Our elderly. We must protect our elderly. So if you're sick, first of all, don't go visit with your elderly mom or dad. Don't go to the nursing home. A lot of nursing homes may institute screening guidelines before you even come, checking you for a fever, and if you're sick, turning you away to visit. So if we see more cases, we do know that in the elderly and geriatric population, this can be a pretty wicked bug and can be lethal. So we must protect our nursing homes, and we must protect our healthcare workers because they're the front lines trying to figure out what's going on.